Welcome everyone, I am Andrew Duckworth and I'd like to thank you all for joining us for our special Festive Edition podcast to round off our series for the year of 2025. I'd like to start by thanking all our listeners for their amazing support for our series. We do hope you've enjoyed the breadth of work we've discussed over the past year, which highlights some of the great studies published in the journal each month, as well as some of the offerings of the journal all told. With that in mind, and to review the past year here at the BJJ, today I'm delighted to again be joined by our awesome editor-in-chief here at the journal, Professor Haddad, who over the next 20 minutes or so will be giving us an overview of the past year, highlighting some key papers we've published here at the journal, and finally what we might expect and hopefully look forward to in 2026. Many thanks for joining us today, Prof. It's great to have you back with us.
Andrew, great. Thank you for doing this. And as we're coming to the end of the year, I think I should start by thanking you for doing a tremendous job on behalf of the journal and the editorial society, in spite of your busy schedule. I don't know if our listeners know, but you've been promoted to one of the most prestigious chairs in the UK in orthopaedics. There's all too few orthopaedic chairs in our country. And, as the chair in Edinburgh, there are some big previous footsteps to follow from the dim and distant past, and a lot of hard work and rebuilding to do. And you've done a wonderful job so far. And I just personally want to congratulate you on behalf of everybody.
That's very kind, Prof. I really appreciate those words. It's very good of you. So, Prof, another year has passed, and I think in many ways a positive year for the specialty as a whole. What do you feel have been the highlights over the past year?
Yeah, it's been a fascinating year and a busy year, Andrew. It's really interesting how the need for orthopedic surgery for our services continues to increase wherever you are in the world. And I've had the privilege of traveling around the globe again this year and seeing multiple healthcare systems at work. But what is without doubt that our services, be that for elective surgery or trauma, are increasingly in need, and that our offerings continue to be refined and to continue to serve patients extremely well. So I think it's really important to recognize how important orthopedic surgery is, not just within surgery, but within healthcare as a whole. And I think one area that probably came to my mind a lot more this year than previously is the fact that by keeping patients mobile, we're not just relieving them of pain. Frankly, we are increasing their ability to live happy and healthy, longer lives. I think mobility correlates with longevity, and I think that's a big plus for orthopedics. From a journal perspective, we've been unbelievably busy this year. The number of submissions continues to go up, and so from a selfish perspective, it's great to see so much high quality research, although we're also seeing some work that really should never see the light of day. And I'm grateful to my specialty editors and to the editorial board and all of our reviewers for helping turn everything around so efficiently, so that we've ended up with a really nice offering, what I believe is a nice offering that our readers have enjoyed throughout the year.
Absolutely, Prof.
And
Yeah, I was just going to just break in there, Prof. In terms of the first comment you made, I think it's really interesting, isn't it, about the frailty side of things. And I think we almost saw that. Well, we did see that with COVID and the big long delays and how frail these patients got when they were waiting on the waiting list. And I think you make such a good point there. Is it's just not about relieving pain in a hip or knee. This is about keeping people active. It's reducing that risk of frailty. It's such an important thing, actually, that, isn't it?
yeah, no, and we kind of remember long ago, just post COVID, we coined this expression that elective surgery is not optional surgery. And I'm pleased to see the BOA and others have grasped this, because we do tend to get pushed to one side when there are winter pressures, when there are strikes, when there's any, limitation on the system. Elective orthopedics sadly takes a hit, and I think we have to keep fighting as a profession for our patients. We are their advocates.
I totally agree. And with regards to journal, I think I totally agree in terms of that large volume of submissions that we are seeing now. I mean, what do you think's been the real key in terms of maintaining that high quality that we now see in the journal, in terms of that, particularly that you always talk about that methodological rigor? What's been the key to that, do you think?
Yeah, so I think we remain strict, and that's the prime driver of what we publish. It's got to be answering a question that's relevant to patients and relevant to clinicians, and it's got to be done in a methodologically sound, reproducible way that we can understand, we can replicate if needed, that can then help uh, surgeons and allied health professionals advise and treat their patients.
Yeah,
And that's the central tenet of what we do. We're fortunate to have by our side bone and joint research to take the more basic science type of work. We're fortunate to have bone and joint open to take more of the, if you like, the protocols, the pilot studies, the review type articles. But for the Bone and Joint Journal, the methodology is fundamentally at the heart of what we look at. And that's
absolutely.
becoming, in some areas, that's quite tricky. I think you and our readers will be aware of the increasing impact of AI
Mm.
on everything that we do. And in reality, AI is going to contribute greatly to our knowledge and to our practice moving forward. But any AI innovation needs to be studied in the same way as any other change in our practice. It's got to be looked at critically, it's got to be transparent, it's got to be generalizable, and we have to understand it before we use it. So I think that's going to be one of the challenges moving forward.
It's interesting to bring up AI, Pro, because very much we almost feel like we're on Scott's parabola with it, really, aren't we? And everybody's starting to use it for absolutely everything. And I just hope with time we will refine that, and it will have a very, very important but very sort of refined place in what we do.
Yeah, and in some places it's going to gain traction very quickly.
Yeah,
In others, it's going to take a very long time, and it'll take a while to unpick the real experts from those who are just jumping on the bandwagon. To to the things that are really going to contribute on a day-to-day basis to patient care, whether that's predicting osteoporosis from one simple set of images to predicting the lifetime of a joint from an X-ray or a joint shape early on. So I think there's lots of really exciting stuff that will come.
absolutely. And probably sort of led into like sort of the other products that we sort of offer. Obviously, we have, like you say, bone and joint research. There's bone and joint open, which obviously has a very, very strong impact factor. Considering how it's still relatively in its infancy in many ways. But I just wanted to talk briefly about first of all the amazing team we have at the journal that back everything up, and also all these amazing digital products that we've developed over the past years, and how they really are building that orthopedic community, that global orthopedic community that we've always wanted to strive for.
Yeah, no, look, it's a great question. Lots of facets to this that are worth stressing. Look, the first one, which I don't think everybody realizes, is the Editorial Society Bone and Joint Journal is an independent publisher. It's a charity, and that is run by a phenomenal group of staff. We often talk of Emma Bodden and her publishing team, but there's a big team there that are all working together to create all these products and actually to move the sort of if you like the direction of the society to where it needs to go, and that's very different to our direct competitors, which are the big heavy hitting publishers that we're competing with. So I think the team has done an amazing job over the last 10-15 years. We've got an impact factor that's up there easily in the top 5 or 10 orthopedic and musculoskeletal journals, and we've stayed there for a few years. This is no accident. We're there on the basis of quality, on the basis of citations, on the basis of the quality of our authors, editorial board, and reviewers. But that's also allowed us to think beyond what is a traditional publishing model. So we've got our standard journals, we've got, if you like, our little digest journal in 360, but now we've really pushed into the use of digital products and how they are going to help our community. Because at the end of the day, what I see for the Editorial Society and for BJJ isn't just a product that helps a single clinician, it is a set of products for our orthopedic and musculoskeletal community to help everybody, be that in their day-to-day practice, be that in their research, be that in their education, whether they are sitting an exam or just majoring in a topic. I want everybody to feel comfortable and know where the material they trust is. And the material they trust should be in the BJJ and with the Editorial Society.
Yeah, no, I completely echo those words, and I think, like you say, all these amazing products that have been developed over the past couple of years, I think really in a relatively short time span. Things like Ortho Media, Ortho Search, and now obviously recently Ortho Publish and BJJ Life, and we obviously did our podcast last month about BJJ Life and the benefit it's having. And I had a few of my trainees come up to me this week, and they said they did UKite, and the most representative thing was BJJ Life, in terms of that testing. And I think it really is amazing how that has just all come together. And like you say, covered the breadth of their training and their orthopedic life in many ways.
That's true, and these products have all been designed to help our people, our community. Uh, author search to kind of clear the mud that you might get with PubMed and other search engines. Author media to be a repository for our key material, for guidelines, for things that you normally would struggle to find or not necessarily trust where you find them. And then I think author publish is a bit of a gem. Any of us who've spent a weekend having to reformat a paper, that should hopefully be a distant memory for the next generation. But you and I have lived through that. And then BJJ Life. I think BJJ Life has been really well received, and actually it shows how well we work with the BOA. It's very different from UKITE. UKITE is the exam that all our trainees will continue to sit. It will help them as they go through their training. But BJJ Life is going to help people prepare for that. It's going to help them prepare for their exams, and quite frankly, it'll help them prepare for their specialty and for ultimately for lifelong learning, because it is reflecting what is in the literature and can take them to what is in the literature right now.
I think that's an important point, isn't it? Because BJ Life is so much more than the questions. There's everything that goes with it, and actually the learning that goes with it. I couldn't agree more. And I say, as you always say, a big shout out to Emma and her team on an amazing amount of work that has gone into that, and an incredible product. So, Prof, if we move, now just briefly talk about a few of the highlight papers from the past year. And as I'm sure some people know, Prof sent me quite a few, and we sort of narrowed them down because there were such good quality out there. And it really does emphasise again, I think, the level of evidence, the level of methodology, and the quality of work being published in the journal, and also, as you said, in our open access journal BJO. And the first of these papers highlights an area that's increasingly relevant to our colleagues, and there's a few papers here that have a theme really to it, and that is the work from Mike Whitehouse's group in Bristol looking at trends in day case hip and knee replacement using data from the NGR, and a really topical study this.
Yeah, no, look, I enjoyed this, and for a number of reasons. I think the first thing to say is that I was the biggest critic of registry data when I took over the journal. There was a lot of poor quality analysis, a lot of flawed interpretation, a misconception of what is association and what is causation. And frankly, we were doing ourselves disservice in the way we were using big data.
Yeah.
The guys have stepped up, and they've stepped up particularly in the UK. And Mike Whitehouse has led a team of statisticians and data analysts who've done a phenomenal job with the National Joint Registry. So everyone needs to be really proud and recognize what Mike has done, because he may not be the face at the front of it. You see other great people sitting as the medical director and the chair and the voice of the NJR, but actually the real engine is Mike and the group in Bristol, who've done the data analysis and frankly raised the bar, because the quality of what you see coming out there is very, very sound. So now we're pleased when we see good data from them, and often just reading the reports is useful in its own right. And I think other registries have had to step up and match that, and they all haven't done it to the same level, but everything's moving in the right direction. But this paper is interesting because outpatient hip and knee replacement, or day case hip and knee replacement as we call it in the UK, has become such a topical big subject worldwide. And yet here's a real world analysis saying we're down to less than 10% for unis and down to sort of 1% for total knees and total hips, which makes you think, what are the drivers here? What are we doing right? What are we doing wrong? Is the US model, is that a patient-centered model, or is it a surgeon-centered model? Is it about the money for the surgeon? Is it about actually patient welfare? And do patients really want to be day surgery candidates for joint arthroplasty? They had no choice during COVID, which is when we had that spike in the UK, but it hasn't kicked on dramatically since then. I'm sure it's going to continue to increase, but this data is impressive because it shows us if that is the way to go, we've got a long way to go in the UK.
Yeah, there's certainly the numbers are not what you really potentially expect them to be, would you? In terms of, it's not the astronomical rise that one would potentially anticipate from that data. And like you say, it's going that way, but it's certainly not the massive frame shift that some maybe would have us suggest. And that sort of leads us on a bit to the next paper, Prof. Looking into, And this is from our colleagues in Argentina. And they were looking at a slightly related thing, predicting the necessity of routine post-operative lab tests after primary total lip arthroplasty and whether they're sort of required or not. And it's quite an interesting data set, this.
Look, it's fascinating. First of all, look, this is a nice paper from Argentina, and that's really important because that shows the international nature of what we do. And they've not only got a good quality database, but they're asking actually quite an important question in terms of health resource utilization. Not everybody needs a full blood count using these LFTs, etc., on the day post surgery. Frankly, not everybody needs a test the
Yeah,
day post surgery because some patients are fitting well and have low complexity surgery and it can be perfectly fine. But then they've used some really nice methods to, if you like, analyze and model that data. And so there's a lot to learn from that. So I really value work coming from all over the world, how we all teach each other. So I really like this paper, but the message here is that we can probably predict which patients can have short stay surgery, which patients can be done in a day surgery unit. The ASC model, ambulatory surgery center model in the US, will inevitably in some sectors follow in the UK. And we will do more patients
yeah,
as day case or overnight or short stay. But beyond that, if we can save on investigations, that will just facilitate that journey. That
absolutely.
that will make it much easier.
And actually, as you say, this is just another piece of that puzzle of trying to tell us which are the ones that might be suitable for that and not, which is, like you say, it's just building all that together to knowing that it's, like you say, not a full frame shift, but actually for some people this is very appropriate. And you sort of mentioned about, data from elsewhere, and I think the next paper is another good example of that, out with the UK, and that's from the Danish Knee Arthroplasty Register, and that looked at almost 2,500 medial unis and the indications and the number of operations following this. And again, some really interesting and strong data from a good registry.
Absolutely. So, Anders Troelsen has done an unbelievable job in Denmark, both in terms of a culture of doing randomized studies as well as good quality registry work, as well as an evidence-based approach to unis that has really made them a big uni country.
Mm.
So, and the uni literature has been dominated by one implant, one set of authors for so long, particularly in the UK. And here we've got real world data at a population level. It's really powerful from a country looking at complications and at the risks. And actually, the profile looks really good. The Danes have moved towards more unis, and their data looks very compelling. The complication rates are low, and they're even learning from this data in terms of, if you have a fracture, quite frankly, think hard about a revision rather than fixation because the data is not so good from that point of view. If you have an infection, let's learn. Sometimes DARE work, sometimes DARE doesn't work. But in reality, this is a hugely supportive data set for unis and suggests that the direction they've taken is one that others may yet wish to follow in terms of increasing the proportion of unis. We've talked about it, we've done it in some centres in the UK. There are other countries, notably North America, where the rate of unis is still very low and where, frankly, they probably still have much to gain from this kind of experience.
Absolutely, absolutely. And Prof, that sort of takes us nicely on to the last study, which I thought was really interesting. And again, I think very topical and looking at the role of PROMs and when and if they're required after total hip and knee arthroplasty. And this was again another example of a different methodology, systematic review with meta-analysis, but one that uses really robust data. This was 24 studies, all RCTs from memory that had baseline PROMs and PROMs at more than 5 years, and some really important take-home messages from it, I think.
Yeah, absolutely. I think we're in an era where we're tussling with that balance between innovation and regulation.
Yeah.
And my sense is regulation and control are starting to dominate a little bit. And that desire for more data, for more evidence, has penalized us already in certain areas. In Europe, with EU MDR and UKCA, we're lagging several years behind with new techniques, new implants, that is going to hurt some of our patients. The need for long-term data, it's particularly been mandated in the US, but actually, quite frankly, the need for data here has taken away a large number of oncology implants, of hand implants, of foot implants. So even though those are rarely used, it doesn't mean they're unimportant.
Yeah.
And so this has really penalized patients. So suddenly doing a piece of work to try and reduce that burden and possibly challenge the need for collecting proms for 10 years, when in reality, the data you get year one, year two is probably the most compelling and most important data. Beyond that, the drift is
Yeah.
probably not related to your intervention, but is related to other things. And the cost of finding those patients and getting their proms later on. So this is an important paper because it's a key challenge to, if you like, a regulatory demand. And sometimes we as a community, because we don't really have a voice
Yeah.
in the EU or in the US mandates. That we've got to be able to use our research to lobby from that point of view. So I thought that was a really important paper from that perspective.
No, like you say, it's using that data and good data to actually argue the point. And I think I totally agree. It was very compelling. I thought that. So, Prof, those are our studies, and just to sort of wrap up, looking forward to the year ahead. What do you think 2026 holds for both, I suppose, our specialty and for us at the journal?
Well, I mean, hopefully it's going to be another good year. I suspect it's going to be a busy one. I think, we're hopefully all colleagues will get the chance to refresh and recharge over the holidays and then go again in the new year. I am very optimistic that we're seeing more and more good quality research in our specialty. And I think, I would urge everybody to come together, think of the important questions that we need to answer for our specialty, for our patients, and frankly, to work together to get answers to those, because that's actually what we need to do to. And as a specialty, we're unique. We can continue to innovate. We can continue to do things to improve the quality of life of our patients. And I think every day, every time, it's rather unusually for an editor in chief. I still operate 3 days a week, and I really enjoy doing it. I enjoy seeing my patients. I enjoy treating them. But actually, the impact that we have through innovating through research is actually much greater than the impact on an individual patient. We can impact on a much larger scale nationally and internationally. So I think people should continue to think of important questions and do good research.
Yeah, no, I think that's a really nice point to finish on, Prof. And so, thank you so much for an excellent overview. And what has been, I think, I agree, a very overall positive year for both our specialty and certainly for our journal. And as ever, it's been great to talk to you, Prof.
Andrew, thank you. As ever, you've done an amazing job.
And finally, we'd like to wish all our listeners and our wider orthopaedic global community a very happy festive period and all the very best for 2026. We at the Journal thank you so much for your continued support. Stay safe and well, and thanks as always for listening. Take care, everyone.